Hey everyone, my name's Sarah Lavonne and welcome back to my YouTube channel. Today we are going to go there and we are going to talk about miscarriage. It is National Pregnancy and Infant Loss Awareness Month. It happens every October, and so I thought it would be important before October's over to actually go there. I think miscarriage isn't talked about enough. Infant loss, neonatal loss, stillbirth is not talked about enough. And so while I could talk about all those things, and if you want me to, let me know down below, I think it's important to discuss miscarriage. And so today we're going to talk about miscarriage. We're going to talk about the statistics of how often it happens, what the signs may be if you're having one, what to do in the case of that, how miscarriages occur and what could be the outcome. And then also I'm going to give you some resources for how to manage the emotional side of having a miscarriage. But before I do that, make sure you subscribe down below, give it a like, share it with a friend, or maybe even a Facebook group that you might find this to be really helpful with. And then let's get started. I have somewhat avoided this topic for the entirety of my channel, to be honest. I think not intentionally because I'm scared of talking about it, but also I think that anytime we're talking about any kind of sensitive topic, I think I personally want to do it justice. I want to say the right thing and I want to help support you and I don't want to leave you hanging. And I feel like in this kind of a platform, I fear that that's the case. But so here's the goal of this video. I want you to know that you are not alone. If you've experienced a miscarriage in the past, if you're worried about a miscarriage, I feel like most pregnancies have that kind of twinge in the back of their mind during their pregnancy. You're not alone in this, that I love you, I care for you, and I want to be an added support to you, even though I'm not there in person. I want to provide some resources and have a conversation to the best of my ability to help not only provide support, but then also the education side of knowing what to expect, etc. And so let's talk about it, all right? So first and foremost, we are talking about miscarriage today, and miscarriage is classified as any pregnancy loss before 20 weeks, all right? So if you are less than 20 weeks, that's considered a miscarriage. After 20 weeks, that would be considered a stillbirth. And then a neonatal loss is an infant loss, so a baby that passes within the first 28 days of life. And so, first of all, I just want to say that this does happen. We know it happens, but more than anything, I think we need to start talking about it more, which is one, why I'm here, and two, why I would love to open up the comment section down below to allow for you to share in whatever way you feel is important to you. I think a lot of times that people that have had a miscarriage, they mourn in silence, they mourn alone with or without a partner. And some of you may have had a miscarriage or you maybe know somebody that's had a miscarriage and you feel very much moved on from it, that you didn't feel as emotionally connected, and that's okay as well. There may be some of you that maybe are watching this and you had a miscarriage 20, 30, 40, 50 years ago. And that is the case. I actually know multiple women who are in their grandma ages and they have had a miscarriage and they still struggle and consider it almost every single day. Okay? And so there is no right or wrong way to grieve the loss of a baby, of a fetus, of a pregnancy, whatever you want to call it, okay? And however long that takes you, my goal for you or my dream for you would be that we can experience healing on the other side and move on with our lives without forgetting the importance of that pregnancy, okay? So that's really my dream for all of us going forward. But let's talk about the statistics on how often miscarriages happen, because I think that one, suffering alone is always harder than suffering with a community, and that's my dream for what Bundle Birth, this channel, my business can be for you. Miscarriage is extremely common. I remember when I was a new labor and delivery nurse, and we're taking patient histories, and one of the things we ask is, how many times have you been pregnant? And then how many live births have you had? And the number of pregnant people that have had more pregnancies than the one they're carrying was shocking to me. And whether that be as a miscarriage or as an abortion, it just, people have experienced loss in their life. This is extremely common. And so if we look at the studies, it actually shows that about 8 to 20% of people that know they are pregnant have had a miscarriage. Now, 80% of those occur in the first 12 weeks. So the first 12 weeks is that first trimester. So I think this is where the stigma comes, where people don't, a lot of times, at least in the United States, they don't share that they're pregnant until they hit that second trimester, because if you're gonna have a miscarriage, a lot of times it happens in that first trimester, okay? Now, is that the right way? I personally think that, especially after my egg freezing vlogs, I'm just like, you know what? I think we fear the unknown or judgment or fill in the blank so much more than what is actually the reality. And what I found through being vulnerable and literally like weeping on camera, if you haven't seen those, they're on my channel, there's a whole playlist on them, was that by being vulnerable, we connect with one another. We have to remember we are human, that we all struggle, that we all go through seasons of abundance and then seasons that are really challenging. And so I think for me, I would love for us to be able to celebrate the news of a pregnancy no matter how long it lasts. Okay. And so that's my like whole little soapbox on that. But again, this is going to be individualized. If you don't feel comfortable, especially if you've experienced multiple losses, it's sometimes harder to have to tell people and then be like, oh, now I've had a loss, I've had this miscarriage, and now we're reliving it every time I tell the story. So again, there's no right or wrong way to this. But I just want to say, if you've had one, that there's nothing to be ashamed about. You are not alone. And again, the moment we start talking about it, the more I think you'll find that by talking about it, there's a lot more people that can relate to you, and then it creates this community of people around you where you can actually grieve together. Now, I said that the rate of miscarriage is about 8 to 20%, but that's the known numbers, okay? And so it's really assumed that the actual rate of miscarriage is actually even higher because most people don't even know that they are pregnant when they're having a miscarriage. There's actually a study that followed hormone levels every day throughout different pregnancies to detect whether a pregnancy was found, and found at that rate, when they're looking at hormone levels rather than knowing ahead of time, that the rate of miscarriage was around 31%. Okay, so this is common. You are not alone in this. If you've experienced one, I assure you there are women and people around you that have also experienced that. Now, you may ask the question, why do we have miscarriages? And why does this happen where the pregnancy doesn't carry to term? Most of the time, it has to do with the fetus. So the actual baby, the embryo, the fetus is what I'm going to call it. It begins to develop, but maybe it stops growing, or most of the time there's some sort of genetic abnormality or chromosomal abnormality that kind of forces the loss, rather than all of the genetic material being growing and multiplying perfectly. So usually that's the case when we look at rates of miscarriage. Now, if you think about a pregnancy and you think about how complex our bodies are, in order to get pregnant, be pregnant, stay pregnant, there's a lot that has to go on. And so sort of like with the fact that we live in a world where things aren't perfect all the time, right? And as cells multiply, they divide and they grow and they grow and they grow. Sometimes that doesn't happen, right? Or the genetic material from the beginning wasn't totally perfect, okay? So that's number one. That's the most common reason for a miscarriage. The other side is on the pregnant person side, right? So the pregnant person may have certain medical problems that may affect the pregnancy, and that could be poorly controlled diabetes. That could be a pre-existing medical condition. It could be a like structural issue where like the shape of the uterus maybe kind of doesn't house the baby quite as well. And so flex and flow on that one, but either there's something going on with the baby, the fetus, right? Or there's something going on with the carrying person's body, right? Now, if you're looking at chances and lowering your risk for a miscarriage, because especially if you've been trying to get pregnant and the news of your pregnancy was positive news, there are a few little things you can do to lower your chances of a miscarriage. But in general, I would say that I want to be very candid that if you've had a miscarriage, I think it's easy to beat yourself up about it. But that's one thing I just want to affirm you in, that you did nothing wrong, okay? That there is really, unless you had a therapeutic abortion or something, that there's nothing you can do to have the miscarriage, right? That like directly affects, other than maybe like overdosing on drugs or something, okay? So if we look at those numbers, things that you can do to lower your chances of having a miscarriage would be avoiding smoking, avoiding excessive alcohol or any alcohol, cocaine in particular, or like injury to your belly. So you have a car accident, right? But no one's like pounding my belly, right? On the regular, I don't do that. And so we need to sort of let that go. Now, if you are pregnant and you are still smoking or you're still drinking or you're doing drugs, particularly cocaine, I'm going to suggest that you stop doing that, especially if you want to continue with the pregnancy, right? And just for the sake of you having a healthy life and a healthy lifestyle, that those aren't recommended. But I would say probably for the majority of you, you're not smoking, drinking, doing drugs, and not pounding on your belly. And so if you're not doing those things, I want you to just take a deep breath. And if you've been beating yourself up, okay, about anything that you have done, there's nothing you can do to other than those things that I mentioned in excess. And even there are people who do drugs their whole pregnancy, smoke, drink, whatever, and carry to full term, right? That causes a miscarriage. It is not your fault. The other side note would be that, like, I think simple things like, oh my gosh, I jumped too much, or I exercised too hard, or I went out, I didn't even know I was pregnant, and I had that one night out on the town where I had like 6 shots with my girlfriends. Like that one night, very, very, very unlikely. In fact, I'm gonna venture to say did not cause the miscarriage. It's not your fault, okay? So that's sort of like the risk factor side of things. Now, if you were having a miscarriage, let's talk about the signs and symptoms of a miscarriage. So this could be anything less than 20 weeks. Obviously, all of this could continue. That's a whole nother video. So if you want one on stillbirth and like carrying a little bit later and then what it would look like to have a loss then, please let me know. I'm happy to go there with you. I have participated in all levels of loss. But what does it look like? What can you anticipate? And this is where I'm going to say the symptoms, and then we're going to talk about them. And please stick around to hear about them because it's not quite so concrete. Your main symptoms are going to be cramping/pain and then vaginal bleeding. Okay? Now, take a deep breath because there are also many, many pregnancies that early on, they have some cramping. You may feel implantation cramping. You may feel like round ligament pain that feels like cramping as things stretch or whatever. There is normal to have some discomforts of pregnancy, okay? But severe cramping where you are having like full-blown menstrual period cramps / worse, constant comes and goes, coupled with pretty severe vaginal bleeding, obviously that's a reason to call your doctor, okay? Doesn't always mean that you're miscarrying, but those are the signs you are going to see if you are going to have a miscarriage, okay? So I always say any vaginal bleeding prior to 37 weeks is considered abnormal unless it's old blood, so like brown tinged, kind of like burnt colored blood versus fresh blood. Like if I prick my finger and I'm like dripping, you know how it's like bright red or like the color of the candle red, that's going to be fresh blood. If you're seeing fresh blood, that would be abnormal, reason to call your doctor, right? Now, sometimes you have some early bleeding in your pregnancy and then you get checked out, everything's okay, and you keep watching it. There's something called a subchorionic hematoma, which is like a little bit of bleeding at the placental site. That's a whole nother video if you want it, that can cause some vaginal bleeding, okay? The gold standard to know whether or not you either are going to miscarry or you have had a miscarriage would be doing an ultrasound to look for a heartbeat, okay? So given the fact that it very much depends on your gestational age or how pregnant you are, anytime if you're suspecting a miscarriage, you're going to call your doctor. That's just a basic rule of thumb. Constantly on my channel, I'm going to tell you that, okay? Call your doctor, check it out. Some may have you come in to be evaluated, especially depending on how pregnant you are. If you're 3 weeks versus 16 weeks, that's going to be a very different scenario, right? And some may just have you wait and see, all right? So, and this is where I've had multiple clients actually that have had miscarriages when they've signed on with me very early, and we've had to process the miscarriage, the loss, and sometimes there's been some frustration with the fact that providers don't want you to come in. Now, the only time you really need them is if you're going to need some assistance to complete the miscarriage. And what I mean by that is there's really 3 ways that a miscarriage could look like, okay? And 3 ways to treat it, all right? The first one is what we call expectant management. That just means we wait and see and we let it pass on its own. Now, if you go into your doctor's appointment, they find out there is no heartbeat, eventually that baby, that fetus will need to come out. You can't leave it in there forever. In fact, it poses an infection risk. And so a lot of times, and I would say a majority of the time, especially the earlier pregnancies, they're going to wait and see, and eventually you will start having some cramping, some bleeding, and you'll manage that at home. You can take some over-the-counter medications. You can talk to your provider if you're needing some extra pain relief, because it can be very, very uncomfortable. And so you would go through that process at home. It would look like a very heavy period. You may have some clotting, that some big chunks of blood come out, and depending on the size of the gestation or the fetus, you may actually see something come out, okay? So, and this is where I think that we could do better being supportive with each other, because I do think there is something different, not better, not worse, just different about seeing the fetus versus it passing and you not really seeing it because of how small it is, okay? So that's expectant management. Now, if that doesn't work, or your body doesn't kind of go into this labor, early small portion of labor on its own, there's 2 assistants that your provider can help you with. One would be a medication. And so that would be over the next couple of days, you'd either take oral or vaginal pills. And so those pills, over the next couple of days, you would experience the same symptoms, and then that helps to let the fetus pass. And then the last result would be that if that's not working, or depending on the gestational age, a lot of times it's flex and flow based on your particular scenario, there are surgical options as well, where they would go in and do what's called a DNC, D&E, to dilate the cervix and then help the baby pass that way, or the fetus pass that way, okay? So this is not fun. It's not the best day of your life, that's for sure, and it's a loss a lot of times. Now, again, I mentioned in the beginning that for some, that feels like the loss of their child. And for others, I will also say that I have seen many people also cope with that was a fetus, that was not a viable pregnancy, I'm okay, and they're genuinely emotionally okay. Okay, and so what I want to say is anything on either spectrum, anything in between, totally fine. That is your way of coping. And if you, but if you are struggling, and if this has taken over your life, and you are grieving the loss of your child, that is valid, that's real, and it's important to take some time and actually grieve it like it was a living, breathing, talking human, right? And that this was a piece of your family. And so a part of coping, one of the things we teach in our bereavement module for our bundle birth nurse mentorship, when we're teaching nurses how to manage patients like you that could come in and have the surgical option, and have nurses taking care of you, of how to be sensitive, one of the most important things is learning, is kind of coming out on the other side with some fruit of how do I move on from this, but also not close it off from my life, to recognize and give power to the fact that was an important human, or that was the important baby child in my life. Give it a name, right? And call him or her by name if you know if it was a him or her. And if not, call that baby by name if that's important to you. Create a memento. People get tattoos. They have some sort of picture that reminds them of that, or a necklace, or a fill in the blank of something that can help remind you of that important, meaningful piece in your life, right? And then we're treating it like any other loss, right? Many of us have lost loved ones. And while I think miscarriage carries this different experience, because you haven't had the one-on-one contact with the person, and you don't have necessarily the same memories, but you have the memory of the pregnancy, or that positive pregnancy test, and the things you've purchased for that baby, or all of them. You have the loss of the memories that you've anticipated in what you will do with that child. And I want to validate those feelings and say that they're normal. There's nothing wrong with you, and it's important to grieve that. Now, you have resources. So I will link some of those in the description box down below. One of them that is pretty well known is nationalshare.com. There's a few really important Instagrams that I will link down below, just as a resource for you to find comfort in your shared experience. I know also there's multiple Facebook groups. There might be local groups, there's support groups, and then there's obviously professional help. And I think that's also one of those things that's been stigmatized. I've been to therapy multiple times. I've had multiple therapists, and I currently have a coach, which is like sort of like a therapist, but different. And I've created a support system around me where I feel like I have my friends and family that are also really amazing listening ears. And so surrounding yourself with the right support to process your feelings. Now, if you are a friend of somebody who's had a miscarriage, be that person to listen. Be gentle with them. Don't tell them how they're supposed to feel, and create this open space, create space for them to share whatever's going on, whether it be true or not. We're not talking about, well, you can always get pregnant again, or, well, it wasn't actually a live baby, so why does it bother you so much, right? We have to recognize that people's experiences are different, and that's okay. It's not better, it's not worse, it's just different. Create that memento, and then reminder to yourself to just be gentle on yourself and with others, that do some self-love, self-care, take some time off work, and whether that be a personal day or you actually share what happened. I think it's important to share, and I think a lot of times when we do share in the right way for us, that we find that we actually have more support around us than we thought we did, which is also why I want to open up the comments down below. I promise you, I will see them. I will acknowledge them. I may even comment on them if you want to share. And I want to know, what was your baby's name? What did you know about them? What was your favorite memory of that pregnancy? Or whatever other details that you feel comfortable sharing. Obviously, it's out in the world, so there are some trolls out there and some not very nice people that could see it. But also, I will say that I just have been so impressed with this community of like just loving, caring people. And, and I think too, if you are watching this and maybe you haven't experienced that yourself, to go send some love and prayers and good vibes. And I'm with you. Wow, what an amazing story. Sounds like this baby was so loved in your womb for however long that was, or whatever, on the comment box down below. Okay. I will be deleting any haters. I will be deleting any comments that are not loving or supportive. So you've been warned, all right? That's not a place that I will allow this channel to go, all right? And then lastly, one of the questions that I frequently get is, when can I try again after I've had a miscarriage? So I want to be clear. I'm not saying you can just try again, but that a lot of times is a question that people have when they've had a miscarriage. And the medical answer to that is when you feel ready. Okay, there's actually, if you want to try the next month and you're like, all right, we've grieved the loss of this, or I feel ready to move on and we want to try to get pregnant again, that absolutely you can. And if you need some time emotionally to set some time aside and grieve and take a second and do the internal work with you and or your partner, then wait, right? But there's no actual medical recommendation other than when you're ready to try and get pregnant again. Thanks everyone for being with me here today. I hope you found that helpful. Again, if you've experienced a loss, I am with you. I am sending so much love and support your way. I hope that you find comfort in knowing that you're not alone and that there's nothing to be ashamed of and that you didn't do anything wrong. If you want more from me, then you can head on over to the description box down below. Everything's down there: Amazon list, childbirth classes, Instagram, and then make sure you subscribe down below. Turn on your notifications so you never miss a future video. And then until next time, don't forget to flex and flow, and I will